Hey there, Dr. Jim Davis with Live Well Chiropractic. Say this video is meant to be an introduction to our remarkable technology called StemWave technology. It is electrohydraulic shock therapy, or a form of orthotripsy, it's called. So similar to lithotripsy, and lithotripsy is, we're all kind of familiar with someone who's had kidney stones, where they go to the hospital and they put them under, and they use ultrasound waves to break up those stones so they can urinate them out. They're actually not ultrasounds, they're actually sound waves. So what this device does is it creates a spark within this head. It looks like an ultrasound head, but this is actually a sonic head. So it creates a spark, which creates a plasma bubble, and that plasma bubble bursts, and it creates a focused sound wave that comes out of that head at about 3,500 miles an hour. So what we're doing is targeting tissue that at one time has been injured or irritated, or even like scar tissue or adhesions. So if a cell itself or a tissue isn't fully healed, this is the way I think about it in my brain. So if this is the tissue, what the body will do is it will surround, like with a ball, it'll surround that tissue with inflammation. And that inflammation inhibits proper blood supply and healing cells, like stem cells, to come and heal it all the way. So what this machine literally will do is it creates a noise, and I'll show you. What that is, that sound wave literally goes in and punches out the inflammation around the tissue. Then what happens is that inflammation that inhibits the blood flow and stem cells to get there, if the inflammation has lessened a great deal, almost immediately the body starts bringing in new blood supply, and also it recruits dormant stem cells to come in and heal the area. And that takes place over time. So oftentimes people will have their first treatment and they'll feel better. And then over time, though, that inflammation slowly comes back because the body doesn't have enough time to fully heal that tissue. And that's why repeated treatments are needed. So what we're going to be doing today is checking out one or two areas in your body, shoulders, knees, hips, back, whatever the case may be for you. This can be uncomfortable. We can control the energy level as well as the frequency. We do not want it to be painful. So if it's uncomfortable, like at a 2 or a 3, that's kind of where we want to keep you, or lower. If it gets up into that 4, 5, 6 range, you let us know. So it's going to be me or Dr. Nancy or one of our techs doing this with you today and going forward. We don't want it to be painful, because when it's painful, it increases the stress response, which isn't a good thing. So we just want to keep it at a spot where you barely feel it, or it's a little bit uncomfortable. We'll walk you through that, okay? So this technology is therapeutic, means it treats things, as well as diagnostic. So we'll know after today, most of the time, if we're going to be able to help, or if this technology is going to be able to help you. 20 to 30% of the time, when we do this mapping, we just tell the candidate, potential patient, or potential client, you know, it's really not going to help in your case. What we're looking for is we're going to be looking for an immediate decrease in pain or increase in function. So we are going to be looking at things like, we're going to be asking you about your pain levels, but we're going to be asking you, like, if you have a knee problem, like doing squats or stepping up on a stair, or shoulders, we might do range of motion, neck, spine, we might be doing range of motion, some muscle testing, that sort of thing. But we're going to pre and post check you, and more than likely we're going to record you on video before and record you on video after, so you can actually see the difference. And then we'll know after one treatment if this is going to be effective. And the neat thing about it is, the research shows that for those who do qualify, 91% of those folks are 80% or more better within 2 to 4 months. It's pretty remarkable technology. So what we're going to be doing is checking out a body part or two, and then we'll let you know right away if this is something that we think is going to help your particular condition. Sorry about that. Video explaining what this does on a cellular level. And by the way, what the research shows too is in that 3 to 4 month range, you'll have about 200 to 300% more blood supply, because this actually, it causes angiogenesis, meaning it grows new blood vessels to the area to heal it. But also you've got dormant stem cells. It turns those on and brings those to the area. So a lot of us have heard of people, or maybe you've already had stem cell injections, where they take stem cells out of your hip or out of umbilical cords, and they inject those into the joints. This is the way your body does it absolutely naturally.